Hello, dear viewers, and welcome back to Good Morning Kuwait, and with our first guest. So, social media, beauty filters, and rapidly changing trends have transformed the way people view their appearance and consider cosmetic procedures. Now, to help us understand how these influences are affecting patients and their expectations, we are pleased to welcome Dr. Yaseen Hasan Yaseen, ENT and head and neck plastic surgery consultant. And good morning to you, doctor, and how are you?
Good morning, Hasan. I'm doing very well. Thank you for having me.
All right. Now, for generations, beauty standards has differed throughout the community and through cultures. So, social media also right now, we're living in a world of social media. So, how has social media become part of a culture that actually influences plastic surgery and cosmetics?
All right. So, since people opened up on social media, the world became a much smaller place. In the past, we were limited to what's surrounding us in terms of community, principles, and cultures. Now we're open up to different cultures, different principles, and even different ideas when it comes to beauty. People have big access to what's being done elsewhere, and they started comparing themselves to actors, celebrities, social media influencers. And this is changing, how people perceive beauty, because most of these people tends to look perfect, either due to using, editing, AI, or even doing cosmetic surgery. Moreover, a lot of people from younger age or generations have access to these things, and started creating sort of a comparison. Why do they look like that, and why do I look like this? In the clinic, we see a lot of people now, instead of coming complaining about a specific problem, bringing in a picture of a celebrity or a social media influencer and wanting to look like them, rather than have a specific problem with their appearance. So it's becoming challenging to select your patient, do what's appropriate within medical ethics and what's not.
All right, it's nice that you actually, or I love that you brought up AI and editing tools, because I remember when social media first started, people used to take pictures spontaneously of themselves and the things surrounding them, and it used to be less of editing tools, less of AI tools, less of filters and all that. But now people do this and they expect to basically go to surgery and have expectations to have the same faces that they use using the AI generated tools or editing and all that. So how does this affect the realistic result and their also their let's say their mental state?
All right, so it's actually very important, and it's on two folds. Number one, the use of cameras nowadays it's becoming very widespread, because it's in your hand. So
Yeah.
you take selfies and what's not. And what people don't realize is that using those cameras, especially the selfie camera, distort their image. It doesn't give you the correct proportion. So they feel that, say, their nose is longer than normal, bigger than normal, because of those specific selfie pictures. And this has been studied extensively, that a lot of people think that they have a specific problem which doesn't exist, purely due to the distortion that's happening because of the way they're taking their pictures. Number two, the perfection that they see, whether when they're putting a filter on or what they see on social media. So they come in and they think that this is something that can be done in reality. And it's very important from the physician perspective to, number one, dig deep into what's the patient concern and what's bothering them in terms of their appearance and how they want it to be fixed. It's 100% you need to be transparent, and you need to be very exact and accurate about what can be achieved and what cannot be achieved. So it's the physician role to educate the patient that what they see on social media when it comes to perfection, what they see with filters when it comes to perfection, might not be achievable on surgery. So knowing what's the patient concern will help us address that in terms of delivering what's possible and what's not when it comes to the whether it's a procedure in the clinic or a surgery in the operating room. By doing that, you raise the chances of patient satisfaction after the surgery, and you avoid the idea or the risk that the patient will leave unsatisfied, needing a revision or a corrective surgery in the future.
All right. Now, a lot of people, they would enter a plastic surgery facility to basically, you know, make major changes in their faces. And they're doing that to mask off because they're unhappy or they have mental problems. But it is not a way to actually delete that unhappiness that they have. Yes, there are times when people go in for a minor plastic surgery just to fix a few things or maybe a major one. But changing your whole appearance just to mask off something does not totally put out the mental problem that you have of being unhappy.
Right. 100%. Now, it's very important to also highlight what you said, Nasser. When it comes to plastic surgery, and at least based on my principle, it's not doing a drastic change to change the patient's appearance totally. It's something to enhance their natural beauty and make them look better rather than changing them altogether.
Exactly.
So it's not a face-off, you know, putting a new face on a specific person, but it's just making them look better for their age, correct specific flaws or problems, so that they feel more comfortable, more confident with their self. So this comes back to the first encounter with the patient. It's the role of the physician to dig deep, to know exactly what's the patient concern and what's bothering them when it comes to their appearance. And we need to be very specific about that, because if you go by, you know, a generalized term, for example, I want to look more beautiful, I want to look more handsome, I want to look like a princess or like a celebrity, this is a recipe for failure, because these terms can be interpreted by different people in different ways. And when the physician tried to translate this into reality on the operating table, it might not be what the patient meant. So it's very important to understand what the patient, or sorry, what's bothering the patient when it comes to their appearance, and if it's something that can be fixed. And the physician have to have a hunch on if there is a deeper psychological problem beneath all of that, because in some patients, it's not wrong to actually direct them to see a specialist, you know, to assess their psychological well-being and try to address that, because there's a medical condition that's known. It's called body dysmorphic disorder, where the patients always think that there is something wrong with their body. So you fix one part, they will focus on something else, and you will be on a never-ending cycle of problems.
And these are the people that get addicted too much to plastic surgery.
Exactly.
To the point that they get dysmorphia.
Exactly. Exactly. Yes.
Totally, they're changed.
Yeah. So it's very important for the physician to take a very detailed history, spend their time with the patient, listen to them, and try to analyze that, so that if there is red flags, they can be addressed prior to taking the patient to the operating room.
In that case, doctor, when do you actually take the decision to tell a patient that we need to do drastic measures into changing your appearance and it's in your best interest?
Well, I would not go into, you know, into that issue that far. So it's not a drastic appearance. You need to listen to the patient, as we mentioned before. So and I try to be as specific as possible. So if a patient comes in wanting to have a rhinoplasty, for example, or a nose job, rather than being satisfied with the patient saying, I want my nose to look nicer, I want my nose to look more beautiful, I want my nose to look natural, I actually try to make them define their objective very clearly. For example, I want my nose shorter, I want my nose to be smaller, I want my nose to be lifted, I am bothered by the hump on the nose, I am bothered by the width of my nose. By understanding these things, you can actually deliver a better, more exact surgical procedure, because being more beautiful is something subjective.
But yet, doctor, there's a lot of people that follow beauty trends that are temporary.
Exactly.
So when you're saying that a person needs to do a rhino surgery where they change the shape of their nose just to make it a little bit shorter, a little bit wider or smaller or narrow, it depends on how it will go. But yet there are people that just follow a trend, and a trend is temporary.
Exactly.
Yet changing something in your face is a lifetime. It's not something that you do like a filter on your smartphone where you can change and shift your face every now and then.
100%. So this is the role of the physician again. It's very important that the physician follows specific principles. Now, if you're following trends, it might be beneficial from a financial perspective, but it's not in the patient's best interest. So it's very important from the physician perspective to be ethically correct, to direct the patient to what's best for them. And I always tell my patient or my customers that natural beauty is everlasting. Trends will end.
Yeah.
Similar, like last year, maroon was in fashion. This year is probably purple.
Yeah.
It's the same with trends in cosmetics. If you do something natural, it will last forever.
Yeah.
However, if you follow a trend, the risk of you coming back for a correction or a revision is very high. And this trend might change your perception or conception about plastic surgery might change with age.
Yeah.
So what you want now when you're young will probably change later
And the
on.
problem is these people, they feel left behind because the moment they take that trend and do that surgery, they're with society. The moment they cannot do the next trend, they feel that they're left behind.
And this is exactly the effect of social media now. It's actually putting pressure on people and making them have that sensation of feeling left behind and not following the trend. And it's our role as physician to enlighten those patients and tell them that, okay, it's, if you don't need plastic surgery, then you don't have to do plastic surgery just because your friends, colleagues, family member did it, because the circumstances for each patient is different. And we have to address you as an individual and not just a member of the community or a society.
All right. So one of the biggest challenges in cosmetic surgery is not performing the first procedure, but managing patients who are unhappy after you perform elsewhere. From your experience, what are the most common reasons patients seek revision surgery, and what misconceptions do they often have about correcting after the first procedure?
All right. So most of the time, people will come unhappy due to two major reasons. Either there was a complication with the surgery that led to unsatisfactory results, or the patient had different expectation from the surgery. Now, having different expectation could be also from two aspects. Either there was miscommunication between the operating surgeon and the patient, so the surgeon oversold the procedure and the patient came in with a less result than what was promised, or that the patient had an idea in their mind which was not communicated properly, and then the result was not to their standards. So this goes back to the minute the doctor sees the patient. If they were clear about their objective, the doctor was following ethical behaviors, told the patient what can be done and what cannot be done, understood exactly what the patient wanted, you eliminate big part of these things and you reduce the risk of needing corrective surgery. We have limited control on how patients heal. So despite doing our best efforts, still there are some patients that might require some touch-ups or corrective measures. Now, what the patient comes in usually after having a failed surgery in the first place is that they are afraid of having another failed surgery afterwards. And it's very important from the physician perspective is to be very clear on what can be done. Doing a corrective surgery is similar to renovating a house. If you have a clean sheet of paper and you want to design a house and build it from the ground up, you have the freedom of putting a good foundation. But if you come for a house that's already built on a shaky foundation, say a problematic previous surgery, then you're limited with what you can do. And your job might be more challenging compared to building a new house.
True.
So it's similar for doing a reconstructive surgery. It's very important to tell the patient, although they sometimes become focused on their results, of their appearance before the surgery, and they come show us pictures of them before the surgery, before the failed attempt to do the cosmetic surgery, saying this is how we were before. But the fact is we're dealing with what's there now. So with their appearance and what we need to fix currently. So we should not promise them that, you know, you will go back to what was there before.
Higher expectations.
Exactly. We should promise them that we're going to do an improvement to what's there now. And it's it's the role of the physician to enlighten the patient about this and be very clear of what can be achieved and what cannot be achieved. In general, the risk of the procedure is more or less the same. It's the outcome that differs slightly because, as we said, you're working on a different foundation compared to having a fresh or a clean piece of paper that you start from the ground up on.
Doctor, last piece of advice when it has to do with people that are basically willing to do plastic surgery. What would you advise them when they enter this realm or this world, and what should they actually be cautious of?
Right. So my advice to those people is, first of all, have the motivation to do the plastic surgery coming from within. It needs to be self-motivated rather than a pressure from peers, family members, or social media. Have very clear objectives and what do you want corrected and addressed rather than going in and just with, let's say, a generalized term or broad terms. I want to look more beautiful, I want to look younger, I want to look more youthful. Be more specific. This will make your treating physician understand you better and give you a better outcome. Choose your surgeon or treating physician properly. Go for someone who's trustworthy, who's well qualified, who's accessible, and who's willing to hear you and address your concern before you take your next step of undergoing the surgery.
All right. Thank you so much, Dr. Yaseen, for being here with us today. It's been a wonderful interview with you and very informed and thorough.
Thank you very much, Nasser. Thank you for having me. Appreciate it.
All right. Thank you so much.
Thank you.
All thanks to Dr. Yaseen for joining us today and helping us understand the medical, psychological, and ethical realities behind cosmetic procedures. It was a pleasure having him today. So with that, we're going to take a break with the report, and we'll be right back after this.